Asthma is defined as reversible airway obstruction. It is a chronic inflammatory disease of the bronchi. During an episode of asthma, an asthma attack, the bronchi become narrowed due to the involuntary contraction of the smooth muscle surrounding the bronchi. Now, this has been proposed to be a survival mechanism, in that this mechanism is a reduction in airflow to limit lung injury. But in asthma, this process has gone awry. Now, a number of external triggers, such as allergens, inhalation of chemical irritants, or even exercise, can induce an asthma attack. It's been reported that as many as 7% of the population has some degree of asthma. Now, an odd observation in regards to sport is that elite athletes seem to have a much higher incidence of asthma than the sedentary population, with over double, 15% of the athletes at the 1996 Olympics so diagnosed. Now, there is a possibility that the legitimate frequency of asthma in elite athletes is the same as in normal populations, and that the athletes are using the therapeutic drugs as ergogenic aids. As these aids would dilate the bronchi and reduce respiratory work, and that would improve breathing efficiency and performance. Now, as the highest incidence of athlete diagnosis of asthma is in endurance sports where respiratory efficiency is imperative for elite success, this suggestion might have some validity. However, asthma can be deadly, with about 4,000 deaths in the United States annually. And banning such therapeutic drugs is likely not viable or an ethical action for sports. The prevalence of asthma in humans has increased over the past few decades. The reasons for this particular phenomenon are myriad, but one of the most unique and has received quite a bit of corroboration as a proposal for explanation is that today's children are brought up in too aseptic of an environment. They aren't essentially vaccinated against environmental allergens through normal and habitual exposure. Now, as parents, we were all exposed to a higher degree of environmental allergens and pathogens. Now, regardless of the reason for the increase in prevalence, coaches and fitness trainers will work with some asthmatic athlete or trainees, and they have to become cognizant of how to safeguard their trainees in the case of an episode of asthma.